So today's webinar is Human Trafficking in Ohio and How to Get Involved. My name is Bethany Friedrichsen. I'm the statewide coordinator for relink.org. Relink.org is a faith-based nonprofit statewide organization based out of Northeast Ohio. We started in 2017 with a desire to use technology to connect those in need due to addiction, incarceration, or human trafficking to the resources in their community. We also make an effort to constantly stay involved within the community through outreach and education, just like this. Today, I will be helping facilitate the webinar. So if anyone has any issues, please message me directly through the chat or send me an email at bfriedrichsen@relink.org. That's up on the screen. Just a couple housekeeping items before we get started. We're so excited to have over 200 registrants for today's webinar representing counties across the state. With so many joining us, we want to make sure that everyone's time is used wisely. When you join the webinar, you will be muted. If you would like to ask a question, please type it in the chat box or the Q&A. I'll be monitoring the questions as we go along to ask the speakers at the Q&A. With so many on the call, we may not be able to get to everyone's questions, but we will try our best. We will have the Q&A at the end and then final announcements. And then after that, if you would like to stay on for a couple more questions, we will do that a little bit past 11. The webinar, like I said, will be wrapping up around 11. It's an hour long. And please stick around to the end. We'll have our final announcements and some key next steps to give you afterwards. We will also be sending out a follow-up email with any resources and information that's shared, as well as a recording of this webinar and a confirmation that you participated. So all of that you'll receive by the end of the week. So without further ado, I'm going to pass this along to our Executive Director, Barbara Campbell, who's going to introduce the topic a little bit today and our moderator for the webinar. Barbara?
Good morning, everybody. Thank you, Bethany, for getting this all organized. Welcome. As Bethany said, I am the Executive Director for the Dalton Foundation, and we are thrilled to be a sponsor of this webinar today. As Bethany mentioned, we started and supported relink.org from the beginning back in 2017, and it has been great to watch it evolve into a tool of resources for the state of Ohio. And Bethany will be sharing a little bit more at the end about relink.org and how it relates to human trafficking and ways that you can access these resources. As I was preparing for this webinar and thinking about it yesterday, I started pulling up our stats from relink.org, and Bethany's got some of them up here on the screen, but we've been really humbled and sad to see the amount of searches that we've had this year in comparison to last year for human trafficking services. We know there's a lot going on this year with COVID, but just seeing these numbers go up has been heartbreaking. And so we're really excited to be bringing this webinar to you today. And the way this got started is actually thanks to Beth. Beth reached out to us, Mr. Dalton and myself, a few weeks ago and shared her passion for this topic. And we just started talking and thought, well, let's get this started by just starting with a webinar. And this is we view as a first step of ways we can see to really inform people, equip people with resources, and really have some meat behind solving this problem. So I really thank Beth for taking the initiative to reach out and get this started. So I want to turn it over to Beth. It's been a pleasure to get to know her over the past month. She is a wife, she is a mother, she is a nurse practitioner, so she's seen this up close in her practice. She's been a member of the Hudson City Council, and now she's running for Ohio House in District 37. So Beth, I want to turn it over to you. Thank you.
Thank you, Barbara, and thank you, Bethany, and all the folks at Relink and the Dalton Foundation for putting this together. It really has been a very collaborative effort, and as Barbara mentioned, I do have a passion for this. Just, you know, as a wife and mother and healthcare provider, it's just been on my heart. You know, we see the statistics in Ohio, and we all think, what can we do? I walk with friends and neighbors, and we talk about this, but largely I think many people have visions of human trafficking that frankly are probably incorrect. And so I just thought, how do we get the information out about what's happening in Ohio? And I'm very thankful to the panel that is on today, experts in the field who are here to enlighten us and share the information, grow some awareness around human trafficking, and really what we can do as regular everyday citizens walking around. How do we recognize it? What do we do about it? What are some of the things that each of them are working on in their organizations? And how do we help them reach their goals and really end this scourge on our society, on all the vulnerable people, not just in Ohio, but across the nation and the world. So with that, I wanted to introduce the panel today. I'm very thankful that you've taken time out of your busy schedules to meet with us and meet with the people through a Zoom. I'm grateful that we have this opportunity. So first I would like to introduce Jomel Aird, and she is with the Ohio Attorney General Dave Yost's office. She's the Director of Victim Services for the Human Trafficking Initiative. And I believe one of the things that she is working on doing is really building that awareness on human trafficking and empowering others to take action and to build that coalition to support victims. So Jomel, if you would mind taking a few minutes, and then I'll move to the rest of the panel to give them a minute as well. Thank you.
Hello, everybody. I'm Jomel. I've been a victim advocate now for almost 10 years. And I love what I do. I love bringing awareness. And the AG Yost has decided to create a group to do big good and to impact the state of Ohio, and to empower Ohioans, to bring awareness to Ohioans, to improve and strengthen our victim services as well, and to create spaces for these real conversations to happen, and to build up our task forces, build up our law enforcement, impact our court systems, just bring average, everyday citizens to understand what is the issue, how can we do better, how can we impact, and how can we just kind of love each other and provide for each other. So I'm definitely glad to be here.
Thank you. Thank you. Next, I'll introduce Pastor Greg Delaney. He is the Hope Director for Reach for Tomorrow, and that is a nonprofit community organization located in Highland County. Is that a dog? I'm not sure. Where he leads a coordinated effort to educate churches and faith community and other community leaders about addiction, trauma, and human trafficking. So we're very thankful to have Pastor Greg Delaney on this morning as well.
Yeah, and thank you. And again, sorry about my vicious killing dog over there, but he's about 11 pounds of menace. But yeah, so Reach for Tomorrow, we're so fortunate to be partnering with the Victims of Crime Act and through grant from our Attorney General to provide those educational services, mainly toward the faith community. But Reach for Tomorrow is in the business of both providing education as well as we do provide counseling services. We do quite a bit of collaboration with other organizations across the state, as well as provide advocacy for victims as well as their families. As you can see there, we have a lot of partnerships, one of them being Recovery Ohio. So we do try to diligently work toward educating the faith community and others about the intersection between substance use disorder as well as human trafficking. And so we have about 20 modules of education that we can provide to organizations at no charge, thanks to the grant, in and around all of these topics, human trafficking 101 to demand reduction to the link between substance use and also trauma. So very excited to be a part of today, and also making ourselves available to all of you who are on the Zoom today to share with you and serve you as well.
Thank you, Greg. Next, Beth Bullock. She is also with Reach for Tomorrow. She's the Director of Advocacy. Wanted to introduce you, Beth.
Hi, thanks so much for having us today. Again, I'm partners with Greg in Reach for Tomorrow, and my role with Reach is as Advocacy Director. And in that role, we do a lot of things, but the biggest thing is really getting the message out there of what trafficking really is and what it really looks like, so that people understand, because it's been so sensationalized. And if you aren't in this arena and you aren't on the street seeing this, you really have no idea what's going on. And I can tell you, we've got a lot of hurt souls in our state right now, and we've really been working hard on that. So but yeah, we do a lot of connecting with other agencies and organizations. We're getting really well connected in the southeast area of Ohio, where they don't have quite as much in our Appalachian area. There'll be more coming on that soon. But really letting people know what the services are. And you know, I'm based in Claremont County, but I'm able to work all over the state, and that's really been a blessing, because it's been able to connecting with people to really see what's going in other areas, figure out what they're doing, see what we're doing, and what are we doing that we can share, so we're not recreating the wheel all the time and making things duplicatable. So thanks for having us today.
Yes, thank you. Next is Kelli Cary. She's the Vice President of Programming at RAHAB Ministries right here in Summit County in Akron. And she has a graduate degree in social work from Case Western Reserve, and she works at RAHAB. So you could share a little bit about what you're doing, Kelli, at RAHAB.
Sure. Good morning, everyone. So I'm Kelli, as Beth said, and I have the privilege of overseeing all the direct services that RAHAB Ministries offers. And we are located in Summit, but we serve mostly Northeast Ohio. And so if you're new to hearing about RAHAB, we have a continuum of care of providing direct services to survivors of sex trafficking or those that are vulnerable to being trafficked. And we do that through outreach, as well as our community-based services. We offer mentoring for youth as well as adults. We also have drop-in centers, and then we also serve survivors through our safe housing. We have an adult safe house as well as a juvenile safe house, and those are our two areas that we really receive referrals all across the state. And I'm just happy to be here, super passionate about community collaboration, and I love getting to connect with other service providers. So thank you for having me.
Yes, absolutely. And last but not least, Christi Bartman, a founder of Eyes Up Appalachia. She's been involved in anti-human trafficking efforts for over a decade, and I would love to hear about what she's doing and a little bit about her background. Christi?
Thank you. Hello, everybody. I appreciate you being here. And actually, I wanted to let you know that the group that's here is the first group to see this preview of Eyes Up Appalachia. So as you've heard everybody say, this effort is a collaborative effort to address human trafficking in Ohio. And one of the biggest problem areas that we've seen, and one of the reasons I left full-time academia to work on this, is that there is very little coverage in southeastern Ohio and Appalachian Ohio as a whole. And so this last month, we have brought out this initiative called Eyes Up Appalachia to illuminate, educate, and activate against human trafficking. And it's a joint effort with under the Appalachian Foundation for Ohio, and they're my fiscal sponsor. And I will be working with all the people you see on this call and many more to work on the initiatives in that area. So thank you for having me here.
Perfect. Well, thanks again. And we're going to move, in the interest of time, we'll move straight into the panel discussion. And you all can just take your turns on who would like to answer it, based on the question. But I have a lot of interest, and I know I've talked to so many people that have similar interests, so I thought we'd get some of this information out. When you think about human trafficking, you all are the experts. When I think about human trafficking, and some of my friends, we may view things very differently. Of course, I'm being educated and I'm researching and all those things, so my perspective might be a little bit different now. But you hear these stories, and I know they're not true, but if you could sort of go through, what does it really look like? There's some common myths out there about human trafficking. Maybe we could start there and then go to what's really happening, and sort of start there. And I know, Beth, like you mentioned that sort of a piece of this in your intro, that you had some direct information that you wanted to share. If you'd like to start, you're more than welcome to.
Sure, yeah. It's really important that not to get caught up in social media and all the things that are going on, because it's easy for people to do that, and they feel like they're really helping and they're sharing hashtags, and I just be honest, that's kind of a stickler with me right now. It's like there's so many things that need to be done, and yes, it's good to bring awareness, but there's some real hurt and some real horrible things that are going on. And I feel like that's sometimes pulling away from that attention from our folks that really need us. So we're really paying attention to getting the truth out there, dispelling some of these myths, not jumping on the bandwagon of everything you see on a social media platform, that this is trafficking or that's trafficking or this text message you're going to get picked up or somebody's going to get hauled off in a Walmart parking lot, because you know, things happen, but not necessarily in that way. The majority of our trafficking victims walk away willingly with their trafficker because of some type of force, fraud, or coercion, or somebody they think is going to help them find a new life or help them make things better. And, you know, our folks in addiction are really being exploited. So that would be the biggest thing that I'd focus on, is getting that message out there of what this really is and what it absolutely is not.
Sure, because I do think that, you know, just from a lay perspective, you do hear often, you know, mothers worried that their children are going to be abducted, you know, that their children are just going to be picked up like in a bathroom or something and taken off to be a sex slave or a you know, labor worker. And I'm not saying that might not happen somewhere, but that's probably not the realistic picture of what's happening in Ohio, if what I'm reading and what I'm hearing from you all is correct.
Yeah, sure. I mean, it can happen,
but
it's not the norm.
Right.
Yeah, what's normal that we see in a lot of the cases is relationship building.
Yes.
Relationship building. It's somebody who the victim knows already, is in a relationship with, maybe even a family member that is trafficking. We have parents, grandparents, uncles, aunts, cousins, people who are trafficking other family members, boyfriends and girlfriends. Not every trafficker is male, so there are definitely female traffickers as well. People who are in need. It all comes down to vulnerabilities. What are you vulnerable?
Yes.
And I think everybody that's on this chat, on this video right now, can probably look back in their lives and say, at one point in my life, I was vulnerable. Whether that was for 5 minutes, that was for an hour, that was for a couple of weeks or a season in your life. And what a trafficker does is they look for that vulnerability and they take advantage of that. They have nothing but time to build trust and rapport with that person, and you think this person is there to support you, to love you, to be a friend to you, to care for you, to provide for you. Meanwhile, they're just kind of biding time, if you will, and then waiting for the opportune moment to be able to now exploit that same vulnerability that you had, that they recognize, and then now turn it and use it against you. So it definitely is very, very relational, is the majority of the cases that we see.
Yeah, it sounds very predatory.
Correct. And so that really goes against the idea. And again, like Beth said, it can happen, the whole like kidnapping or, but the majority of our cases is not that way. And so when people are focused on, be careful of the white van at the mall, or something can happen in the bathroom, are these things that we should be aware of our surroundings? Absolutely, right? But when something like that happened, it doesn't mean that that's going to turn to trafficking. That could be somebody having other illicit and terrible things planned, like a sexual assault, like a robbery, like a kidnapping, like wanting to take someone's life, et cetera, right? Which are all terrible things. But when those things happen, it's not always equal to this person's now going to be trafficked.
Right.
So something to kind of keep in mind. And so a trafficker may be somebody that is familiar to the family, and you have no idea that daughter's boyfriend or daughter's girlfriend is grooming this person for victimization. And also victims are not always females as well. So it can definitely be boys and men that are victims. So just kind of help dispel those kind of myths.
Yeah, thank you.
I think I think to add to that too, is that it's not necessarily, you know, an in-person vulnerability either. Some of our greatest vulnerabilities now are online. And so that same relationship building, that same, you know, targeting and grooming also happens virtually. And a lot of times that's even a more vulnerable position, because those folks that are being, you know, targeted or isolated and, you know, kind of out of mind's eye when they're online. And so, you know, it's just being, you know, vigilant and aware that that kind of behavior is going on, not just one-on-one in person, but also over the internet as well.
I think you both mentioned two things that sort of stood out. The targeting and the grooming. For someone not in your world, tell me what that looks like. So how do you identify those behaviors? What are the targeting and grooming behaviors that someone else, like a parent or a teacher or whoever might be in this person's life, might be able to pick up on? Are there key things that you could share with us?
I can speak to that if you'd like, Beth.
Thank you.
Yeah, sure. So I think one of the things, like on a broad view of like how we explain trafficking sometimes, is there's those three ingredients that have to be present. So a vulnerable person, an exploiter, and then the demand, somebody that actually wants to purchase or benefit from the trafficking as well. And I think when we talk about vulnerabilities, there's a lot of things that you can look for. A lot of times people who are vulnerable when talking about, I'll start with minors, might be children who don't have a lot of healthy social supports. That's also true with adults as well, not having healthy social supports. We also see those that have difficult home lives that really don't have maybe the safe people surrounding them to be able to be aware and have eyes on when a predator does approach them, either online, or if a boyfriend or friend or another family member tries to exploit them. If they don't have those healthy social supports at home, or the trafficking is taking place in the home, that's the vulnerability. Also, we see, a lot of times history of abuse, sexual abuse, physical abuse, really being vulnerabilities as well. Runaway youth, and I know there's a lot in the media about, missing children as well, and how they are, if they don't want to be at home, obviously that's a perfect opportunity for somebody to exploit, because they can meet a need. And so I think that anytime, if you look at it as like anybody, adult or minor, that is looking to have a need met, I think that is really the key of what makes someone vulnerable. And we've already touched on this, but individuals, adults and minors that have mental health or addiction as well, you can exploit those vulnerabilities because they are trying to meet a need. And then I also think we talk about a lot, and anybody else can kind of touch on this, that a lot of the underlying root of even all those things sometimes is poverty too, exploiting somebody because they have that deep-rooted physical need that's not being met.
Yeah, Kelly, I'd like to jump in on that one, because if you look at a rural area, it's very different than a metro area. So you look at trafficking in Ohio, we handle trafficking through like a coalition effort, and that's the reason, because it's so community centric. But to build on what Kelly was saying, in rural areas, you'll see a lot of lack of resources. You'll see those vulnerabilities expand. Poverty. Some of the counties in Appalachia, Ohio, have 31% poverty. It's amazing. You'll see lack of education, very heavy in high school diploma or below, very few percentage of upper degrees. You'll see geographical separation. You'll see a lack of transportation to those services if the services are available. And you'll see a very high incidence of drug use and abuse. And those things together just build that base that Kelly was talking about, to make somebody much more vulnerable to being approached for this, or to being forced, brought, or coerced into an instance like this.
Yeah, thank you for that. It makes me think about just, Maslow's hierarchy of needs, really just making sure like that whole foundation of who we are as a people, and that those basic needs have to be met before you can get anywhere else in life and have a healthy, and just the value of the family unit, like being healthy and supported.
Yeah, I was just about to bring up Maslow's hierarchy of needs. I always add that to my presentation.
Oh wow.
Even just a feeling of love, right?
Yes.
You may have all the material things, right? I worked as a survivor. Mom and dad one was a doctor, one was a lawyer, lived in a very nice neighborhood, very nice home, but they were never home as much. And daughter was looking for somebody to just show love, right? She had all the tangible things. And so on paper, she was taken care of, she was provided for, all of those things. But that love piece, that sense of like, somebody sees me,
Yes.
I am valued, and actually hearing those words and somebody just being present was missing. And
Yeah.
so that's where that, when we talk about grooming, it's that relationship building, right? So it's kind of like a fishing pole, just kind of like providing more and more line and then bringing the person in and in and in and building that trust. And so at some point, that's where that exploitation comes in, when they feel like, okay, I've got this person really hooked and believing that I am a vital and important person in their lives, that they see me and that they will also do things that I may ask for them, and they may even feel obligated because I provided X, Y, and Z, and because nobody else has provided X, Y, and Z. So just kind of, that's where that grooming process kind of comes into play.
Yeah, thank you for sharing that.
Beth,
It
can I
just,
jump real quickly into what Jomel said? One of the things that makes this so difficult is, so you take the individual, just like Jomel was describing, but they will not use the word human trafficking. They don't understand that they were trafficked. Almost everybody I talk to that works particularly with juveniles, they have no idea what that word means. They don't feel they were. They are very ashamed of their actions. They felt like they brought it upon themselves. It really makes it so much more difficult to understand and to identify, because you take that individual who is truly a victim, but they don't understand that.
yeah. Wow. It just makes you feel like there's so many, what can we do, I guess. It's such a deep problem, and it's just really almost like a chasm in society that's just like, how do you solve that? What are some steps that you think, just like, as a mom, I think of things, that I do with my kids and just neighbors, friends, ways that we can be just interested in others and value others and show them that, that we care and that we see them and be a light for them and be a resource for them. And maybe there are places that, we need people to stand in, obviously we need people to stand in the gap for people that are having like seasons of hardship, whether it be family issues or whatever, and people to step up. But that just might be my idealistic, what I'd like to do. But what do you all sense, like across the board, of things that you think that people can do?
I can jump in on that for a minute.
Yeah.
It's similar. With the work that we're involved in right now, it's similar to the opiate epidemic. Right now we're reacting, we're putting Band-Aids on things.
Yeah.
And we can do that, and we have to do that. We have to stand there and we have to help the ones who are in this now. But we have to back it up to a very young age and get prevention in there better. We have to teach them, and we're doing some programs down here in a couple of our schools in the area, even kindergarten, young age, what healthy boundaries are.
Yeah.
When I grew up, I was told, you respect your elders. Somebody tells you to do something, you do it. No, that's not okay anymore. This is no longer stranger danger. This is tricky people, and it can be family. It could be somebody at your church. It could be somebody at your school. It could be a coach. So we have to start teaching them at a young age, and it's nobody's fault that we have it. It's just now that we know we need to. But we've got to get these prevention programs into our younger kids, that it's okay to say no. And your body has a healthy boundary, and nobody touches you, and nobody does this, and it's okay to run away. And if you feel scared, this is what you do, and start building those protective factors in them at a very young age. And I think that is going to be one of the only ways we're really going to break this. Are we ever going to break this? Probably not. People are always going to be there to take advantage and hurt somebody. But I think we can make a heck of a dent in it if we work on the prevention part of this early. And what do we do now? We keep getting out there. We keep taking, we take hygiene bags, and we take little lunch sacks out to people. We just randomly go out and find people and drive around and look for people who are in need. And when you're out there and you start talking to them, and we go up in the rural areas in Adams County and such, and just a particular thing about up in the Manchester area, it's just get out and you meet people and you talk to them and you start learning what their stories are. You can see the gaps opening. You can see it, and you can read between the lines, and that's how we're able to get in and do some of the work we've been able to do, because just hearing those stories. But that prevention I think is key to this.
Yeah. This wasn't one of my questions, but it's just something I'm thinking of. Probably not politically correct at all, but I'm just going to say it. You think about the spiritual needs of people, and as a Christian, I think about just like always training my children and speaking God's word to them and letting them know like that they're made in the image of God, and who they are, like who they are is because of like who God is and who made them, how he made them to be. And that they have a plan and a purpose. And so like building them up, no matter what happens in life, they have that rock, you know, and I just think like that is such a key thing. I mean, that we can try all kinds of solutions, and we should meet people wherever they are on this journey. But you think about like Band-Aids, you know, different resources to offer. It's just like that sort of missing, that missing piece. Yeah.
It is. I mean, this is definitely a spiritual warfare. We've seen
It is.
It is. It is the biggest spiritual warfare of our life.
Yeah.
And you can see that when we're praying with, you know, some of the girls that we work with, and we're out with them, and you just hug them and you pray with them, and at least you're planting the seed and giving a little bit of hope there. But you're right. It is definitely.
Yeah. What do you think about, you know, so last year, for instance, my kids were off for the last semester, the spring semester, and now many across Ohio don't have in-person school. Some have hybrid. How does that affect, do you think, you know, if there are these issues that are, and we know there are, going on within a family, seems like that's just another indicator, like another issue that's isolating young people from others outside of their family network that could identify things like this. How is that impacting? How do you see that impacting sort of what's going on with human trafficking? What do you say, and how do we head that off?
I can speak a little bit to that just from RAHAB's standpoint of, I'm so glad that question is asked, because I think that we talk a lot about how we see this culture of isolation right now with everything that's going on, and how that's probably impacting our youth. We would think we're actually seeing now, as even the pandemic grows and as we're online even more, that youth specifically are more vulnerable than ever, because they're spending more time isolated, alone, online, as well as just not having those positive, again, relationships. So, you know, in our mentoring program, we have youth that feel like alone during this time and feel like they don't have their school counselors or their teachers that they rely on to really maybe fill that gap that maybe they're not getting at home. So we really focus on making sure our mentoring, not only our drop-in for mentoring, but our one-on-one mentoring has really increased during this time to really care for those that have experienced that. And then I was going to say, you know, when we were talking about what we can do, I think it's the same too as like when Jomel said relationship is kind of a tactic sometimes used by trafficker. Yes. It's also our tactic of how to combat it as well, is walking alongside people, knowing that it's for the long haul and not giving up on people. That's something that, you know, we do through all of our programming, but that's what that anybody can do. People that aren't in this field can walk alongside people, can, you know, volunteer at organizations that walk alongside people who need that aftercare. So it's kind of interesting that relationship and those healthy supports are part of the prevention, but it's also part of the aftercare too.
Yes. Yeah. Thank you.
One thing to maybe add to that too is it's appropriate relationship too. It's being educated as to what our folks that, you know, are on the survivor side of this have dealt with, but also what it is to understand what the trauma that someone might be experiencing. What does that look like? How do I, you know, healthily have a relationship with folks that I've been called to serve? Sometimes we make assumptions. I know within the church we make assumptions, and we have to be careful with that. And so part of what we really try to stress is, you know, learn a little bit about what's going on. Be comfortable about asking what's happened rather than what's wrong. Let's be able to effectively, you know, go in and have a meaningful conversation and create that trust to where some of those things can start to be, you know, opened up and exposed, so that then we can, you know, either provide the appropriate service, connect to the appropriate service, or, you know, make the, you know, the appropriate next move for someone. Because sometimes what we don't want to do is do more harm. And so without really understanding what someone's, you know, dealing with and what they have dealt with,
totally.
We just need to be cognizant.
Yeah, no, thank you for pointing that out. I definitely think, and as a nurse practitioner, I can tell you the first thing you have to do is build a relationship with a patient when you walk in the room. So you've got to, gain trust, but be interested and be there and find out who they are and what their needs are and what their experience has been, and work from there, not from a sort of a preconceived notion of what you think they need, because everybody's at a different spot, and they all have different. Yeah.
If I could add one more thing when it comes to relationships and our families, addressing the things that are happening within your own family.
Yeah.
Right. There's so many things that are considered normal, but it's dysfunction that happens in our families in general. That
Sure.
without realizing kind of teaches not just kids but also adults, this is how things function. Right.
Right.
And mental health and things like that nature is never really addressed. Therapy or family counseling is not really seen in a positive light. When a lot of people hear therapy or counseling, they don't want to go because the idea, or whether it's society or within their family environment, is that you only go to therapy if you're quote unquote crazy, which is not supposed to be the statement at all. Right. So we all can benefit from going to counseling, going to therapy, and truly addressing the traumas that we experience as individuals, but also the traumas that we experience within our families and within our just inner circles and within our environment that's even around, like in our neighborhoods, and just keeps going out and out and out. So I think when you choose to be intentional to address those things, you're also impacting the vulnerability curve, if you will, right?
Yes.
And so by having healthy responses to things that are happening, not just we're going to go to therapy because something bad happened and that's the only time you go to therapy, but just kind of having this idea that an ongoing healthy environment and just taking care of mental health is super important, and having the practice of speaking up and talking about your feelings, having the practice of being heard and know that you are going to be believed as well. And so all those pieces kind of add to that vulnerability when you feel like you're in a situation and you don't have anybody to talk to. You don't think you're going to be believed. Everybody knows what happened, but the adults in your life and the people in your life are not doing anything about it. So then that just kind of compounds everything. And then you look at things through a different lens and you kind of feel like I'm this victim in the middle of all these things, and it's okay for people to treat me in this way. So you have that, but not just even for kids. I think sometimes we can focus on children, and Kelli brought up her point, adults are victims as well, right? I've worked with survivors that have their victimization didn't start until they were in the middle of college or after college. I've also worked with survivors that were in their 40s and their 50s, and that's when their trafficking experience started. So understanding that any age group, again, it just comes down to that vulnerability. And if you don't have people in your circle in your 40s that you can be able to talk to and say, hey, I'm struggling with this. This is happening to me. And know what resources to reach out to and that kind of stuff, it can truly impact. So just kind of keeping that in mind with healthy mental health intentionality.
Yeah, that's really important. Can anyone speak to what labor trafficking, human labor trafficking looks like in Ohio? Because I think when we talk about human trafficking, or at least with many, it's like you think of, like you said, kids, or you think of juveniles, sex trafficking, a number of different things. Can you all speak to what the labor trafficking looks like? Or is that a concern?
Sure. Yeah, I can speak to that. Sure. So with labor trafficking, it comes down to, so the issue is that working in itself is not illegal, right?
Yeah.
And so understanding what the labor laws are of where you live is important. And so if you are not being paid, if you are making below minimum wage, if you are working excessive amount of hours, if there are people who are taking advantage of you in that situation, we see it both in our domestic meaning US born citizens, as well as foreign nationals, right?
Okay.
And so some of the vulnerabilities, let's say somebody who's foreign national, maybe the employer may hold on to your documents for what they may say is safekeeping, right? And so I'll keep your passport safe, or I'll keep your documentation safe. What that is, it ends up being a method of control. So when you want to leave and you don't have your documents, if anybody's ever traveled outside of where they're from. And if you don't have your ID or anything that says who you are to be able to get back home, that's problematic, right? If you don't speak the language, if you are threatened with deportation, even if you are legally okay to be in the United States, if you will, just the idea that you have committed a crime or your employer tells you you have committed a crime or that they will tell them X, Y, and Z. And we also have it with somebody who is a United States citizen and maybe they may have convictions on their records and they can't get certain jobs that they want to be able to improve their way of life. And so now you have somebody who's working under the table to be able to provide for their families. And so now you're working under the table and there's no HR for you to complain to when something goes wrong or when somebody's treating you in a certain way. When there's abuse that is happening and neglect that's happening, you're not being paid. And so people literally can just take advantage of somebody in the labor sect. And labor trafficking could be in the agricultural industry. It can be in the hospitality industry, construction, in the medical field with nurses as well. There's just so many, like literally in any industry, right? Again, it just comes down to somebody choosing to exploit and take advantage of what that vulnerability might be. And so we see that a lot with we see it more so here in Ohio. We have a large agricultural industry that we do have a lot of migrant workers.
Yes.
We also have, construction as well. And when you have construction, there are different layers, right? So you have a contractor, you may have a business, and they contract out to somebody else in another company to find workers. And that company contracts somebody else to find workers. Mm-hmm. And so at the top, there really isn't that true, many times that idea that something illicit is happening to get this building built, but there is things that are going on. So kind of, you can find it in many different situations. And then another part that is starting to be looked at is when it comes to gangs, right? How many times have there been juveniles that are forced to work on the street corners and sell drugs or shoplift or do whatever that might be for hours and hours and hours at a time? They are not being paid for it. They are also being more so criminalized and looked at, you are doing these wrong things, but really there's somebody else who's in control, right? So kind of understanding that that labor trafficking is happening all around us, and it also is sometimes intertwined with sex trafficking as well. When you have like an illicit massage parlor, where you have both sex trafficking and labor trafficking that's happening simultaneously, that's another branch to look at.
Well, thank you. So want to get to something that I'm particularly interested in as well, is what do you see as policy initiatives or legislative updates that you all think are needed and necessary? If you have any thoughts on any of those things.
One that's ongoing right now, one of the ways that Ohio is really fallen down in comparison to other states is what we call the safe harbor statute. And we have safe harbor for minors that are 16 and below, but we have this gap between 16 and 18 where there are still some ways we need to prove fraud, force, or coercion. Senator has a bill in process right now to try to address that, but at this point it's still in process. But that's one of the primary ones that I've seen out there.
Right. Yeah, I'm familiar with that one.
I can jump in for a minute. Just one of the barriers that, and I don't know how we change this. I don't know what that would look like, but it's something that's a case that we're involved in right now. Is we have HIPAA, and it's a very fine line, and it's when those kind of things are in place, it puts blocks between those of us that are advocates for law enforcement through a hospital or medical staff, and it makes things very, very difficult to be able to navigate that. I don't know what the answer is. I don't know how we fix that, or what we need to put in place there. But if there was some way that we could bridge that gap between those of us who need to work with that person and those who are providing care to that person in a medical situation in that moment, that would be huge. If we would have a way that we could share information or be able to work collaboratively together, that would work. That would be really good.
I think that's a good idea, and I think that's being done now with COVID-19. Certainly, there's been some changes in the HIPAA restrictions, so can be more exchange of information between various health departments and hospitals, labs, or schools. So certainly, I think there's opportunity there to.
Yeah, because the last thing we want to do is burn bridges. We all have contacts, and if
Yes.
we need something or we need help on something, and we got a text number, we got somebody that can help us, but yet we have these relationships. In one particular one I'm thinking of, this is a medical situation, and I don't want to burn bridges with her.
Right.
I need to refer other girls to her, other things, and it's a very fine line to walk for putting somebody in the middle, between law enforcement and their job and what their requirements are. It's a very hard place to be. So, you don't want to burn those bridges. You want to make sure you've got all the help you need.
Right. Thank you. I think that's a great point.
Another update for legislation is when it comes to sex trafficking, we have there's a statute called soliciting for prostitution.
Mm-hmm.
And what we're trying to do now is address the demand side, right? Because the more, when you think of supply and demand, there is supply because there's a demand.
Right.
And so one of the ideas is to be able to kind of have a different charge called engaging. So somebody who is purchasing sex, that way the person who is coming to buy sex is going to get charged with specifically engaging in prostitution. Because right now it's all kind of under the same as solicitation. And the average person, and typically we have more men that are buying sex than women, and the average fine that somebody may get is $75 to address their soliciting charge, which is pretty low, even less than a normal speeding ticket usually.
Right.
And so what we're trying to do is have that split, so that way we're capturing that you are buying sex and you are part of the issue. And one of the things also is that there's something called John School. What John School is an opportunity that when somebody is caught purchasing sex or trying to purchase sex, they can have an opportunity to learn what they are engaging in.
Right.
There are some people who really don't know in general. There are other people who kind of just don't care, right? And so it's an opportunity to kind of have a learning opportunity, but also there's a cost for John School. They learn not just that this person that you're coming here to try to meet with, to have sex, is more likely a victim of trafficking, but also what are some of the other issues that are going on? What are some of the health issues? What are some of understanding that this is not just a transaction and that's it, this is a human being, and that a lot of people are able to kind of disassociate and kind of I have a daughter at home, but over here, this is not somebody else's daughter, right? To kind of help bridge that gap. And so then we also have another bill that's currently, I can't remember right now if it's in the House or if it's in the Senate. It's called the John's Database, where it will be an opportunity for that if somebody is caught purchasing sex and they have received a conviction for it. So usually the steps are the first time you get to have that John School class, you get caught a second time, then you could probably get a conviction on that. And then as you continue, if you continue getting caught, those charges will start to kind of increase. So instead of it'll go from a misdemeanor to now up to like a felony, depending on how many times this has happened.
Sure.
And you'd be located in this database and have this information that you are engaging in prostitution and continuing to do that. And this is where now it'll be a public database, people can be able to see that you are engaging in this kind of activity. So that's another thing that's also in the works, along with another bill called receiving proceeds. And so that's when you have situations where it'll be more helpful for our law enforcement when a trafficker is using money, right? They are gaining money from a victim that they have under their control. And so when there is money that is shown that it is coming from a trafficking situation, sex trafficking situation, somebody who purchased sex, law enforcement can be able to link that and now also charge that you are receiving proceeds from this particular crime. So it kind of helps link that. That's another bill that is in the works as well. So definitely keep an eye on those things. Call your representatives, your senators, and what Christi mentioned about getting that age. We're the only state in Ohio in the country that still has the age of consent under the age of 18. Number one. And number two, just to have our laws match with the other things. So if you if somebody takes a photo of a 16-year-old that does not have any clothes on, they can be charged with, you know, child pornography and that kind of stuff. But yet, if you're 16 and you're caught in a situation where you are being trafficked, law enforcement has to prove this compulsion or coercion, which kind of goes very differently than what some of our other laws. So this will kind of be able to help match everything for our under 18 folks. So those are a few things.
Yeah, thank you so much. I think sounds like a great work. And I like that, you know, Kelli brought up these 3 points, like the vulnerability, the exploiter, and the demand, and it kind of addresses like all those different areas, which I think is really important. I know that we are nearing our time to take some questions, but just wanted to circle back to one last thing, and if you all want to add anything before we do the questions, but wanted to say, you know, you all have mentioned different programs like mentoring programs, different opportunities that people can get involved. Is it that they need to, like, how would someone get involved with those things? Is there like a website? Do you go to your site? The other thing would be, well, we can start there and then move on to the next one in just a minute. Yeah. Like for instance, Kelli, with you had mentioned, I think the mentoring programs. How does that work? Like
Sure. Yeah, happy to talk on that. So I would say if you're wanting to get involved, you know, really look at the resources in your local community, whoever is doing this work, what victim service agencies, coalitions, who's part of that coordinated response that's doing the direct service. In our area, we have amazing service providers, but specifically at RAHAB, so we have some opportunities that folks can really engage and work one-on-one with survivors after going through training with us. And that would be our minor mentoring program is one of those areas. And they can just go to our website, and we have a volunteer page and fill out a contact form. And we can definitely set them up that way. And that's rahab-ministries.org. We also have opportunities to serve in other capacities at our drop-in centers. So we have a drop-in center in Akron, as well as we're opening up 2 in Stark this fall. So if individuals want to, again, volunteer one-on-one with adult women who are being exploited, they can do that as well, and they can contact us that way. And then if you're in a different community and you need resources and you're not sure, you're like, well, who are the victim service agencies? Where can I volunteer or get involved? I would say Jomel's a great resource for that too, because she's got the pulse of what's going on across the state.
So how are you all coordinated together? Because when I think about, you know, leading the charge against something like this, you know, all efforts, you want to be coordinated on the goal and make sure that you're not, you know, recreating the wheel, and that you're utilizing resources and sharing resources and all that. How does that happen on the back end with you all? Is it Jomel, is that your organization with Yost that's helping to do that, or what's that look like? I don't know. Like
it's a collaboration for sure, right?
Yeah.
We have the AG's Human Trafficking Initiative. There's also the Governor's Human Trafficking Task Force, and then there's also all the different coalitions that currently exist, along with the different nonprofits, the different law enforcement groups, et cetera, et cetera, et cetera. And so one of the things that our team has been doing is kind of finding out like what exists, right? What is out there? Also, what has been working really well?
Yeah.
And why, right? And for some agencies or coalitions or groups, there are certain things that work really well in their area, and there's other things like, hey, we're struggling with this. In another area, they may have something that, you know, we're really strong in this, we're struggling in. It's kind of the opposite, and so we can kind of connect. Here's a group that had the same issues that you're having, and they were able to kind of figure out how to make that work. We'll connect you with each other. The kind of understanding what is currently out there, what do we need, and also how can we be able to identify what's missing, right? What are those gaps, and how do we now start addressing those gaps in a healthy way that we are being intentional and not just shooting from the hip, if you will, right? So we want to make sure that whatever solutions that we come up with, that they are long lasting, they're impactful, and that we can be able to have as many people on the table as possible to truly impact the state of Ohio. So that's kind of what we've been doing. And at the AG's office, we have the Human Trafficking Commission. And so there's different subcommittees. There's a victim services subcommittee, there's law enforcement, there's public awareness. We have a healthcare subcommittee. So just kind of all of those like big areas where we know that a victim is in need of or needs to get connected to. How can we impact and change and improve what's happening here in our state? And also just learning what is out there, because there may be a county that there's a new organization that I have no idea that they exist, but somebody now that's part of the commission or that's connected with somebody will say, hey, we have this over here, somebody, and then we'll have a meeting, connect, find out what do they do, what are they about, do they do direct services, how can we help support, all of those things. So it's kind of for sure a collaborative effort
Yes.
to kind of work together.
Sure.
I think the biggest thing is also everybody putting their egos to the side and just doing the work, right? So I think it can be very easy in whatever industry or discipline that you work in to kind of have this idea that we do it the best and that's it.
Right.
you know? So to kind of have this
I agree. And
moment.
it's certainly, and I think it's so refreshing to see people from across the state of Ohio and all these different areas on this call today, because you know what may work in Northeast Ohio may not work in Southern Ohio, and so I think always the folks closest to the problem can identify like solutions that work best for their communities. And so I really applaud you all for doing that hard work every day and being in touch with this in your area. Thank you so much. I think now is a perfect time to take some questions, because I've probably passed my point of when I should have done that. So I apologize. But Bethany, do we have any questions? Okay, perfect.
Yeah, I've been monitoring, and I'm going to briefly, before we just jump to the questions, talk about relink.org and how people can access the resources on there. So if people are interested, I know we got some pre-survey questions about where you can access information, and the AG's office has a great website too that I'll share in the follow-up. But as far as relink.org and what we've done, we have brought together a bunch of resources in the state and put them into our resource database that also exists for addiction recovery, reentry, and other topics across a continuum. So if anybody goes to relink.org and clicks find resources, you can put in your city, the city that you're looking for help for someone in, and select human trafficking. Let's say I was looking in Akron. This is just a quick demo of how it works, and I was looking for crisis services. You can then click through to safe houses and shelters, for example, but we also have hotlines, other basic and crisis needs in there, things like prevention resources. All of that is also under the human trafficking button. But it will produce a list of resources or organizations that are closest to farthest from the city that you enter. Then you can click on the organization. It'll display all the information about them, where you can get in touch with them, and all of that right from either your desktop or it's mobile friendly as well. So it's a really great thing to have at your fingertips, and I just wanted to share that. I'll go back, I wanted to share this Get Involved area where we list all the coalitions for the state of Ohio that we have found doing work in these areas. So you can click on that button to find those initiatives too. So now I will move on to the Q&A. I know that we are getting close to 11 o'clock, so I understand if anybody has to jump off, but hopefully we can stay on a little bit longer today. I think it was just a great discussion, and I would like to keep it going just a few minutes past. And of course, you'll all get the follow-up email with the next steps and things included as well, with how to continue to get involved in all the resources. A couple questions from the audience, and I've seen a couple of people raising their hand. We're only going to do questions through the chat today or the Q&A, so if you have questions, please send them in that way. A couple key things is what are some next steps that someone would do if they suspect that someone is a victim or might be a victim of human trafficking? What can someone do? So I don't know who wants to take that, either maybe Kelli or Jomel.
I can start, and then Jomel, if you want to jump in, if that sounds okay. I think that if you suspect that somebody is being trafficked, be knowledgeable of your local resources is the most important thing. So if you suspect that somebody is being trafficked and it's an adult maybe that you're working with or that you have come in contact with, they have self-determination to get to choose what kind of services, if any, that they might want or need. We also have, if it's minor children, of course, if you suspect that, definitely contacting local law enforcement and children's services is really important. But I would also say, you know, we do have the national hotline to make tips and reports, and that is a great resource to use. But I also think it's really important to know what's happening, what coordinated response, what law enforcement and social services are available in your area, because I think the more options, the better. Jomel mentioned that we have 3 solidified law enforcement task forces throughout the state, and they all have 24/7 human trafficking tip lines that you can contact. And then there are other communities that have initiatives, such as in Summit County. I'll speak to the county I'm in. Although we don't have a formalized task force, we do have a 24/7 human trafficking law enforcement line through the Summit County Sheriff's Office that you can call. And so if you're wanting law enforcement to be involved, or just wanting to even just pass on a tip, even if you're not sure what's going on, you can absolutely do that. And then also, I would say, you know, we've mentioned really linking with the community leaders and coalition leaders that are in your community to know if you're trying to get a referral for somebody for resources.
Mm-hmm. Great. Does anybody else have anything to add to that?
Yeah, I think Kelli hit pretty much everything.
Okay, all right, great.
And the biggest thing also, if you see something, say something.
Mm-hmm.
And as you continue to educate yourself on what is human trafficking specifically, and on those resources, you can be able to do that accordingly. And if you call your local law enforcement, call them. You know, local law enforcement. If you don't know how to get in touch with a task force or what have you, call your local law enforcement. They should be able to connect with a detective that is working that kind of issue, or even be assigned that issue in your area in case one does not currently exist. I'm also going to put the Human Trafficking Initiative website in the chat as well. We have a bunch of different resources and options and things for people to kind of explore and learn and look. So I'll put that in the chat now.
Okay, great. Thank you.
Don't be afraid to ask questions. I mean, don't be afraid to ask questions. There aren't any stupid questions where this is concerned. And I'd rather somebody ask questions and nod and then maybe miss something. And a lot of times I'll put in my training, this is why we have to know what this is and what it really looks like and what the real side of trafficking is because we might be the only way that person has to get out of that situation. And if we miss that, they may not get another opportunity. And I don't say that to put pressure on people, but just to emphasize the fact that we really have to understand what this is and what's going on around us. So questions are great. Ask your local organizations or whoever you have access to.
Yeah, definitely. Thank you for those great responses. One common question that it seems we're getting is resources for education within schools. Greg, I know you sent a couple things into the chat, and I'll make sure that's included in the follow-up. But does anybody want to talk about some ways that maybe people can get materials to get into schools, or some work that's being done maybe by certain initiatives? Greg, do you want to talk about that?
Yeah, what I placed into the chat were primarily on the internet side. And so there's an organization we partner with is called awiredfamily.org. They're based out of Cincinnati. They're wonderful in terms of helping parents who are managing the homeschool environment currently. Also, our partner Shared Hope International does a wonderful job on kind of a back to school kind of things, especially with COVID and internet things. I know Beth has done some work on the prevention side within schools for a certain population. Also, our friends at Appalachia, Ohio have a program that has been done with the high schools that's accessible, and I'll put that link in the chat here in just a second. Often, and I'll let some of my more qualified folks on the panel maybe comment on this. Getting into a school is a very difficult proposition. in terms of finding space to have the conversation. At least that's been my experience here in Montgomery County area. I don't know if anyone else can speak to, maybe your success or other programs that have had more success. I'll kind of defer on that.
Yeah, I can jump on that too. We get a lot of pushback from schools for a lot of different reasons. If you're on the call and you have a relationship with someone in the school that can open that door to that conversation, that would be great. Even with the Shared Hope International information, they're very tasteful in their presentations and their video, and we get a lot of pushback on that. So that would be a great way, just so everybody knows. And you would think that it would be something you'd want have your teachers to have access to, but there's just we get a lot of pushback on that, and we get a lot of pushback from the faith community. And those are two places that we really need to break in and really start this prevention discussion and awareness.
I see one of the questions, or one of the things that someone mentioned. I see they brought up the topic how they were working with someone who got introduced or was getting groomed through Snapchat. And I know, Greg, you mentioned the online kind of piece. Would anyone like to talk any more about that? Because I think that's really important. And I'd love to hear a little bit more about that.
Yeah, these programs in particular are really designed to educate the parent as to really the nefarious nature of some of this, online stuff. TikTok, we get so much, especially with COVID and all kind of the fun thing of the guy on the broom, doing the TikTok video. But underneath that is some pretty nefarious stuff. Typically what we've learned is if there's a messaging engine that kind of hangs out underneath it, it's a great place for someone to kind of wander in and begin a conversation. We actually do an internet education as a part of our programming within Reach for Tomorrow in partnership with the Wired Family and Shared Hope. So those are good places to start. There's also quite a bit that a parent can do in terms of security on your router. Remember that you're a parent. It's okay to check your kid's phone, and it's okay
Absolutely.
to, I think sometimes we get, but it's well within your right, as well as, it's just in this day and age, there's so much access, and and the sophistication that's happening behind the scenes is off the chain. I mean, when we talk about algorithmic, efforts being run to look for keywords in order to kind of see, okay, I kind of want to go over here in this DM because this particular kid is showing a vulnerability around what they've been talking about, that kind of stuff. Wow. That's going on. And so but there are some tools there that are good, and then we can come in and do a deeper dive if somebody wants to spend a couple hours and really get some deep knowledge about not only what's going on but how to prevent it.
Sure. Now, do you have a link that's like an online something or other that any parent could get on anytime with their kids or just like with their family and watch, or is it something that you put on occasionally? How does one access that?
Yeah, we're in the process of within something we call Reach Academy. It should be online before the end of the fall, where we'll have some online access for someone to take a look at it. We're also posting some things to YouTube. If you go out to either one of those links that I had posted, that'll come over in your follow-up. There are some online things that a family can sit down and watch together on both of them. And so good ways to dip your toe into it. And then in the case of the Wired Family one, the gentleman that runs that, Stephen, he actually did a book that's an outstanding resource for families to go out and get that can help to equip and educate folks on this as well. When you take a look at it from an online perspective, the other real challenge is the pornographic industry. Yes. They act as a pretty hardy fuel for all of this. When you talk about the number of hits that Pornhub got in 2018 being well over 55 billion, and you think you only got 6 billion people on the planet, you got a lot going on, and the younger accessibility to that and exposure. So there's a lot of correlation that goes along with that education as well.
Thank you.
Yeah. And I think that along that topic, we have gotten a couple questions about the individuals doing the trafficking and kind of how to work maybe on the end of, who the predators are or what's creating the demand, things like that, working on that end of it. I think, Jomel, you touched on some policy things. Is there anything else maybe education for, you know, men, or, you know, because I know it can be men or women, but anything around that that's being done?
Not as far as legislation, but when it comes to who are the predators can be anybody, right? It just comes down to anybody who is willing and wanting to exploit another person for their own personal gain. And so there is not one look, there isn't one race, there isn't one age group, there isn't one gender, there isn't one demographic when it comes to, we have some traffickers that have lengthy criminal histories and that are involved with drugs and violent offenses, that kind of stuff. You know, and you have other people who are in law enforcement. You have other people who have been, you know, teachers, who have been coaches, who have been just a stay-at-home mom. There are so many options. It just, again, it comes down to this person can be anybody. So I can tell you, they're not. What you're not looking for is somebody in what is considered a pimp suit, in a colorful suit, and that kind of stuff. And so just understanding that there was a time period years and years ago where that was more of a glorified image, if you will. And the idea that the word pimp is a cool word, or somebody who is a ladies' man, but a trafficker, a sex trafficker, is a pimp. And so we can be able to connect those two things and understand that when you hear that word, whether it's in music, whether it's in everyday conversation, just to understand what the gravity and the reality of that really is. Then as far as the demand side, here in Ohio, and I think in most across the country, the demand side is our men, our fathers, uncles, grandpas, pastors, teachers, coaches, doctors, lawyers, prosecutors, law enforcement. Literally, it could be anybody. And what we've also seen is, specifically though, it's men with disposable income, that they can have this extra money to be able to spend on that. A lot of times we see that they are men who are married and that have families. We've also seen it's also young men in their college ages and stuff like that. And so the idea that buying sex is okay and is normal, I think that needs to also be part of that conversation in your circles, that this is not okay. It is not healthy. I mean, what are some of the problems with that, right? And so even when you think about a bachelor party, the first thing people think about is strippers, right? Or people either inviting strippers over, go to the strip club or what have you. So the idea of sex and money kind of being this like celebratory moment. And a lot of times when Greg mentioned pornography, when somebody's introduced to something, usually it continues to go down the slope, right? So it gets the desire for more. So what was satisfying at one point, which just to watch, is no longer satisfying anymore. It kind of continues to go down this slide, if you will. And so we have a lot of times when there are men who are interviewed before and after John School, they've, you know, kind of expressed that I'm addicted to pornography and I was not getting that fix anymore as much, and I wanted to now try out what I've been seeing in person. Or there's issues in my marriage and I need to engage in something that I can kind of be able to just have this other moment and be numb or what have you. So there's just a lot of things there. And so also the idea that pornography is just okay to watch, and that there is no boundaries within watching it, you know what I mean? And so when Greg mentioned that there are more people who are exposed at an earlier age, right now the average age is 9 years old that a child is introduced to pornography, seemingly not necessarily because they're looking for it, but because of these things, right? And so again, anything, phones and social media can be very positive. It's just how it's used and what people get exposed to. So for a short example, I have a friend and they are teaching their daughter about animals. They're talking about animals that live in a desert. And they're talking about camels and how a camel's feet look a certain way and the humps and whatever. And so the daughter decides to ask Siri to show her a camel's, and you can fill in the blank. And so understand that completely innocent, but by kids' curiosity or being on YouTube and looking for Doc McStuffins or looking for Paw Patrol or what have you, that sometimes they may come across something that they were not initially trying to come across. And now this image has been presented to them. And then now things may kind of escalate from there. So kind of just keeping those things in mind and having these, again, healthy conversations at every age. So that's with grandpa, that's also with your 6-year-old son and daughter as well. So I hope that answers the question.
Yeah.
Hey, Jomel, I had a quick question that I wanted to ask that someone else asked as well. Is there any data on the effectiveness of the John School? Like if men or women are enrolled in that, is there any effectiveness in that?
Yeah, so there is some research on that, and it depends on the John School, right? So we have some John Schools that are 1 day, that are on the weekend for 8 hours, and that's it. We have, and also depending on the person purchasing sex as well, the fact that they got caught that one time and they're afraid of other people finding out, that might be enough of a deterrent for that person. For other people, it may not be enough, and they just figure out, how do I not get caught the next time, right? So there are some other states and things that have John Schools that are weeks long, that also include counseling, that include therapy, that include probation and community service and all the other kind of stuff that kind of goes along with it. So one of our goals, hopefully for the state of Ohio, is to kind of improve what that John School looks like, because also not every county has John School, like an in-person John School that people can go and learn about these things and actually have a detective or somebody who's working these cases explain, this is what you are purchasing, and then have a prosecutor come in and explain, and have a health provider come in and explain, and have somebody who was actively engaging in purchasing sex and now is no longer, and is now advocating on behalf of victims, but also talking to, you know, other buyers and say, hey, this is, you're not the only person, but here's what you can do to kind of impact that and change. So that way you can be able to stop this behavior.
Yeah, makes sense. Well, I know that we still have probably a couple other questions, but I was thinking about sending those to the panelists and getting those responses to send out with the follow-up. What do you think, Barbara?
I think that's fine. One last question that someone did ask, I think that I wanted to ask, it came to me via email while y'all were talking. You've touched a lot about, obviously, the effects on the victims and some of the consequences for those seeking the sex. What are some of the consequences for those caught as traffickers? Are those penalties steep enough to be a deterrent? Is that an area that can be worked on? I don't know if that's going to ultimately be a deterrent, might be a Band-Aid, but just wanted your thoughts on that.
I can speak to that. So trafficking in persons is a felony of the first degree, which is the high, it goes from like a felony 5, 4, 3, 2, 1. So it's the highest one. The minimum mandatory is 10 years in prison, and that can also be per victim. So if we understand that a trafficker may have anywhere from 3 to 5 to 7 victims, and if there's that many charges, that person could essentially get 10 years for each, possibly for each victim. It also comes with a sex offender registration as well. I believe it's at the tier 2, it's a 25-year sex offender registration that comes along with that. So you have all those things that are part of that. And then it also comes down to court situations. So trial and convictions, and as a victim, do you have the support that you need to, and are you ready to really talk about this in trial, right? If this trafficker, many traffickers are not like, oh, you know, you caught me, you're right, I'm guilty, put me away, right? So they do try to fight it, which would mean that they are looking towards the opportunity for their victims to have to come into court and to stand in a room, to sit in a room in front of people that you don't know, right? In front of a jury who's going to hear the things that you've experienced, which is terrifying, and hear that in front of the person that's been also abusing you. So that can also be a barrier at times for a victim to be able to stand up and kind of have that experience. And some victims are able to, and some victims are not, and it's just whatever that person's personal choice is, where they are in their life, what they can or can't do, or they feel that they have support or not support. It just kind of depends on that situation. So, and then underneath the trafficking persons, there's other charges like attempted trafficking in persons. There is promoting prostitution and compelling prostitution. So promoting will include that you know, brought this person to the hotel, you are taking their picture, you are posting, you know, those kinds of things. When it comes to sex trafficking, you're actively engaging and looking for people to victimize for that. And then compelling, you do have that a piece where you're using that compulsion, you're using that force, fraud, coercion kind of piece to kind of get this person to obey and to do the things that you want them to do. And so those are some of the things that are underneath the trafficking in persons. And you have other types of crimes, because trafficking is an illicit activity. So usually other kinds of crimes that kind of go along with that. There might be money laundering as well. There might be drug trafficking. There might be felonious assault that comes under there as well. There might be child pornography, distribution of child pornography that comes into there. So a trafficking case has so many different layers that are a part of it. And so, like, I think recently there was an operation or a case that somebody was indicted on, and it was 23 counts of charges, different kinds of charges. And so usually there's a lot of different things that are happening, and multiple people that are involved, right? It's not just all the time just one trafficker. It's a few people that are part of this illicit organization that are victimizing other folks. So that's kind of, so depending on that person's criminal history, depending on what type of charges, all those things kind of have their own minimum mandatory and time and all those things that are kind of connected.
Thanks for sharing all that. There are a lot of penalties in place then for these crimes, yet it's still become a problem. We have so many more good questions coming in, and a lot of them are for specific regions. And I think it's just reiterated the point back to the beginning where Beth and I were talking before this all started, of how this is the beginning of a discussion. I think what we want to do is look at all these other questions that are coming in for specific regions and make sure we start connecting people to the tangible resources, to the answers to their questions. And then perhaps even schedule a follow-up on this topic, maybe diving deeper into one of these things, maybe of how people can specifically react and respond when they suspect trafficking, so that we can create a public that's much more aware to maybe help be a deterrent. Beth, is there any last thing that you'd like to say? Again, I thank you, all you panelists, for being here today. It's been just an amazing discussion. And Beth, I thank you for instigating and bringing this idea to us. We were, Dalton Foundation was very thrilled to host this today.
Oh, well, thank you. And thank you to all the panelists and to Dalton Foundation and Relink, especially for putting it together. It's been very enlightening. And I know that, you know, I haven't had a chance to read through all of the messages as I've tried to focus on the panelists, but that's going to be bring a lot of information as well. And I just appreciate the good work that you're doing, and I just encourage you to stay at it. You're making a difference, and I look forward to helping you in the legislature in the fall. Thanks so much.
Thank you. Thank you everyone so much for taking the time today. Again, I will be sending out a follow-up email by the end of the day, Friday, with as much information as I can gather through all the chat and everything. I will also be posing those individual or specific questions to our panelists so that they can get back to you with responses. A couple other follow-up things for those of you who are still joining us or still on with us. For follow-up or for continued information about these topics, we always post things on our Facebook page. So please go and follow us there. We also would love for you to check out relink.org and look for the resources in your community. Again, I'll share the AG's resources too. We also have a couple upcoming webinars, one next week on September 10th on COVID-19 addiction and the faith community, and kind of how those things are intersecting right now. We also have one that we're finalizing details for September 24th on the impacts of addiction on youth, that will be having some doctors from Akron Children's speaking on that. So watch for details in the follow-up about all of these things. Please take the post-webinar survey. And of course, let me know if you have any other questions or things you would like to address. I hope that everyone has a beautiful rest of their day, and we hope to see you on a future webinar. So thank you all.
Thank you all. Have a great day.